Good morning, good afternoon, good night to all the people who registered for this webinar. I welcome you warmly wherever you are in the world. I know you are over 300 people who registered. Welcome to a very challenging topic. And first of all, my name is Bettina Borisch. I'm the CEO of the World Federation of Public Health Associations and a professor at the University of Geneva Institute of Global Health. I do have the pleasure to have a very great expert with me, Professor Raman Bedi. Professor Raman Bedi is the chair of the Oral Health Working Group of the World Federation of Public Health Associations. He also is an emeritus professor of King's College London. Hello and welcome, Professor Bedi. Before we both start and really go to this challenging topic, I would like to acknowledge the support that we got to run this webinar from several organizations. It is the University of Geneva, the World Federation of Public Health Associations, the Global Child Dental Fund, and Colgate. Thanks to all of them for having us given this support. I think that the topic chosen, oral health, oral child health as a human right, is challenging and challenging in challenging times. I would like to say that because it is important, we are going to record the whole webinar and we are going to have the recorded webinar available for all of those who could not attend. But now it's my pleasure and honor to invite Professor Raman Bedi to give us his input lecture on the topic. Is this really a human right for all children in the world, oral health? Thank you, Professor Bedi, for being with us.
Bettina, thank you. And thank you everyone for making this possible. So we are revisiting a message which we have been promoting for almost a decade, that oral health is a human right for a child. And so I'm going to give this short talk for about 15 minutes, and then we'll have some questions. But basically, there's never been a more important time that we should be aware of the challenges to child oral health. Now, historically, we know that dental caries is still a major public health problem, and over 60 to 90% of children have dental cavities. And in young children, most of these are untreated. This has been raised by a number of people, including the WHO, in the Lancet series recently. The burden of oral health is significant. Next slide, please. But we had probably one of the first declarations on child oral health in 2006. This was in the United Kingdom when there was the UK held the presidency of the EU. There was a declaration on child oral health, and it basically asked for two things. One, that there should be a focus on child oral health, and that there should be a task force established. And one of the results of that task force was the promotion of a senior dental leadership program. This was signed by over 40 senior members of the profession, many of them chief dental officers, including the FDI and the WHO. Next slide, please. But you can have declarations, and declarations can have some impact. And of course, so often, unless they're sustained, it runs out of steam. So what happened to the declaration in 2005, 2006? Well, we immediately had Colgate-Palmolive formally supporting the declaration and announcing to the New York Stock Exchange that this task force was their 200th anniversary gift to children worldwide. Immediately afterwards, Henry Schein came on board, a large retailer, or the largest dental retailer in the world. And then we had academic partners of Harvard School of Dental Medicine and King's College London, who came together to promote a senior dental leadership program. And that now in its 13th to 14th year is still going strong. Next slide. There was all sorts of activities happening in different places. And so we had a great response in Philippines, where the health minister launched the 7 o'clock toothbrushing habit. And children from all over the Philippines were using a fluoridated toothbrush, and it became the 7 o'clock habit. But we look back now at almost 13 years, and of course, with changes of ministers, changes of focus, and priorities, these campaigns tend to be have a limited lifespan. But it was good actually that they responded. Next slide, please. That declaration also created a project of Seal Cambodia, where over 60,000 children, in the end it was 66,000, who actually received fissure sealants, fluoride toothbrushes and toothpaste, and dental health education, predominantly in Phnom Penh. And this project had a major impact, and it began to refocus many organizations from treatment to prevention. We also saw projects in Saudi Arabia and many other countries that began to have an impact using the basis of this declaration as the trigger to undertake these activities. Next slide, please. But one of the main activities of the declaration was the creation of a senior dental leadership program with its academic partners of Harvard and King's. And then, of course, the two companies of Colgate and Henry Schein. That collaboration has lasted now nearly 14 years, and we are into our 14th cohort with over 200 senior dental individuals who have participated in the program, each returning to their country and undertaking activities and programs, which has been very, very impressive. Next slide. Thank you. So in 2013, the creation of the Oral Health Working Group of the WFPHA was created. And as the founding chair, one of the first activities we undertook was to discuss the human right of a child with regard to oral health. Now, oral health has always been seen as a human right, but we haven't spelled out what that actually means. And so what we did as a working group was to begin the documentation of what it meant that every child in this world should expect and have a right to. They have a right to safety, they have a right to education, they have a right to food security. But in all health terms, what does this actually mean? Next slide, please. The working group came up with a declaration on oral health for children in 2013. This was taken to the Governing Council in May and approved unanimously. It then was sent to every national public health association, and it became the policy of that association. And as it became a policy of the Governing Council of the WFPHA. Next slide, please. So in detail, what did it actually say? It says that every child, of course, should have a right to good oral health. But specifically, there were 4 activities. One, that they should have access to preventive materials and educational advice, especially to affordable toothbrushes and toothpaste that contain fluoride. There should be interventions that actually improved oral health and prevention, including fissure sealants, regular fluoride varnish applications, and where possible and appropriate, community water fluoridation. Early carers should be treated, and there should be environments where unhealthy foods were eliminated from advertising to children. So this declaration was really supplemented almost 8 to 9 years after the first declaration on child oral health. Next slide, please. And again, it had a fragmented approach. Some countries embraced it, and others it didn't have very much impact. But one country where it did have an impact was in Mexico. Mexico embraced the human rights issue, and in the city of Mexico, this was signed by the minister, and a toothbrushing campaign was undertaken. Next slide, please. One of the benefits was that daily toothbrushing in school became a statutory requirement for children. And to date, I believe 30 million children across Mexico are having daily toothbrushing as a statutory requirement in schools, which is a great achievement, and it was one of the bases of it. And a number of other countries undertook that activity as well. Next slide, please. Since that time, we've also documented the unfortunate situation of the amount of sugar still in infant formula products. And of course, this is creating a major issue for child oral health. In this recent publication, one of the statements in the public press came out that we were able to show that there's much sugar in some infant formula milk products than there is in carbonated sugary drinks. Next slide, please. The other thing that was slightly sad was that with the introduction of the sugar tax in many countries, or the sugar sweetened beverage taxation, is that how little integration there was between oral health promotion and public health. And the focus of this taxation in many countries has been on obesity. And although there is a common risk approach that is there are specific issues that we could improve oral health regarding toothbrushing by sealants and fluoride varnish, etc. But we were unable in most countries to see any activities or any of the income raised from this taxation towards specifically oral health promotion. And in fact, we saw very little integration between the public health and the oral health promotion. Next slide, please. And of course, recently, although the focus of this talk is not on the UK, we saw on the 7th of October of this year, a report of the progress of the sugar reduction, which at best is mixed. The strategy for the last 3 years has been on 3 activities: the reformulation of foods and drinks with sugar, the produce reduction in the portion size, and of course, shifting the consumer from high sugar to low sugar products. And although there has been some progress, it's been very mixed, and in many areas, there's been very little progress. So more work needs to be done. So why did the World Federation of Public Health Associations want to revisit the declarations on child oral health? The reason is that the pandemic that we are facing across the world will have all sorts of consequences. The economic fallout of the pandemic will mean inequalities and financial hardship in many families. This will result inevitably in poor foods and diets, and of course, a risk of increasing child dental caries. We will see a reduction in services and the things that governments can provide, and therefore there's a risk that access to dental care will be challenged. There is never a more important time for us to focus on child dental caries and child oral health. The result of the pandemic will unfold over the next few years, and if not the next few decades. And in one way, all the indicators show us that we will be challenged with poor child oral health. Even though it was poor at the beginning of the pandemic, it will certainly go in the wrong direction for any improvements. Therefore, the revisiting of a declaration on child oral health is really important. We need to refocus and be alert to the fact that we need to address child oral health in multiple ways. In the way we use prevention and the way we use innovation with prevention. Putting together strategies where we make sure that all children have access to toothbrushing and fluoride toothpaste. We need to also make sure that diets are suitably, we're vigilant about the poorer diets and certainly the high sugar content in many of the diets. And if this trend will increase, we need to be aware of it and to address it. The question is, what did we learn from the last two declarations in 2005 and 6 and the 2013 declaration? What we learned is that there were pockets of activities around the world, but actually what we didn't have is an integrated approach with our public health colleagues and our dental public health colleagues and a common risk strategy with regard to sugar. Next slide, please. One of the reasons for that is that when we look at dental public health capacity around the world, we see many parts of the world where there's very few trained dental professionals. And in fact, the majority of dental public health specialists work in academia and not in the health service or within the ministries of health. Therefore, child oral health has to be addressed by the wider public health community. This has to be done in an integrated way, not only with regard to oral health and general health, but it also needs to be clearly manifest in the responsibilities of our public colleagues. Next slide, please. So finally, the clear message of this webinar today is we don't really need any more declarations. We don't need to highlight the fact that child oral health is in a disastrous situation, and obviously there will be consequences of the post-COVID. What we need is alliances. We need alliances across the healthcare professionals and further afield. We need to refocus on prevention and particularly innovation in prevention, and especially how this relates to children. General practitioners need to be alert to the fact that the problem with child oral health and its consequences, and certainly work with other primary healthcare workers and certainly with health visitors and GPs, etc., where that's appropriate. But most importantly, we need to prioritize prevention and how to implement the well-accepted public health measures and how we can achieve scale quickly. Last year, we at the World Federation of Public Health Associations, we launched the Taiwan Declaration. The Taiwan Declaration is really important in the sense it calls for integration of oral and general health promotion and also oral and general healthcare. We didn't know when we actually were undertaking the declaration, which happened in the last quarter of 2019, that there was a world pandemic about to hit us. And that declaration is now even more important with regard to child oral health. I'm just going to show you a short animation that actually explains what this declaration is about. Next slide, please. Okay, Michelle, are we struggling to?
No.
Okay.
The Taiwan Declaration on the Integration of Oral and General Health was launched in 2019. It was a milestone in global health, making integration a reality. The declaration called for recognition of 6 key facts about oral health, highlighting the shared risk factors of poor oral and general health and the mutual benefits of integration. The declaration also included 6 priority action areas to facilitate integration. For example, applying a health and oral health in all policies approach. 3 short-term activities were proposed: advocacy, thought leadership, and fostering tailored implementation. These activities have stimulated a number of countries to develop interventions to integrate oral health into general health. Dr. Shu Ti-Chiu's numerous projects have highlighted how funding from the Taiwanese sin tax from cigarette sales can be used to cover the costs of this integration. The Taiwan Declaration on the Integration of Oral and General Health is an excellent working example of a national strategy to embed health and oral health in all policies to promote good oral and general health. Dr. Bruce Donoff, a pioneer of the integration of dental and oral health in the USA, states that the combined teaching of dental and medical students is significantly effective in the integration of oral health into general healthcare. Dr. Donoff highlights the importance of the Lancet series titled Oral Health, which pointed to integration as a solution to the global oral health crisis. Research by Professor Mahesh Verma shows that diabetes, cardiovascular disease, and poor oral health are the leading causes of mortality in India, and integrating oral and general health could achieve improvements in non-communicable disease rates. Dr. Mengistu Asnaki's work highlighted that multitasking and transferable skills are essential in low-income countries. His research shows that this is often the only solution in rural areas due to limited resources and low workforce numbers. This is demonstrated in the Community Health Extension Programme in Ethiopia, which is a great case study for how political action and community engagement can aid in the integration of dental care into general health care in a low-income country. Based on the feasibility of the interventions across the world, Dr. Borisch advocated for a new dialogue between global agencies and governments to make sure integration became a reality everywhere. She highlighted how it could empower overall health promotion, prevent the increase of oral diseases, and boost health equity. It's not only advisable, but is critical, and it's important for everyone.
Thank you. So thank you very much, Bettina. And I'll end now with 3 key messages. The first is the implications of the pandemic means that there is going to be severe economic challenges in most countries. That will mean the challenges of providing services. It will mean poor diets for families that are affected economically, and affordability of dental care and of prevention, like toothbrushing and toothpaste. The second thing is that we need to focus on prevention, and we need to focus on innovation with regard to prevention. But of course, remembering the fact that we have establishing procedures like toothbrushing, fluoride toothpaste, fissure sealants, and fluoride varnish. And the third and final message is that we must create healthy alliances if we're going to meet the implications of this pandemic and child oral health. And the Taiwan Declaration gives us an insight into how we should undertake that. Thank you very much.
Thank you, Professor Bedi. Thank you. And I think it is a timely lecture. And before we open up the floor to others, I take my advantage of being the moderator to ask you one very first burning question for me. You said no more declarations, more action for prevention. You mentioned very interesting examples from different parts in the world, individual prevention, but also structural one, like sugar taxes. What do you think is now, in a situation where we have a crisis and there will be, as you said, economical hardship, the best buy for you that works well to get this a reality, oral health for all children?
Well, I think one of the challenges in many parts of the country has been that there has been no trained person in dental public health at all in many countries. We particularly see that in Africa, we see that in parts of Asia. So first of all, people need to recognize that oral health is an issue, and whether they're dentally trained or medically trained or public health trained, they need to recognize that oral health needs to be addressed. But it also needs to be addressed in an integrated way. So I think awareness of the oral health challenge, and then of course, there are simple things that we know that can be undertaken. Toothbrushing with a fluoride toothpaste is certainly one of them. It's one of the most effective public health measures we can undertake. And of course, a strategic direction to reduce sugar in child diets.
Yes, thank you. And who should join in alliances? Because you mentioned some of the people who you're thinking of. We see that one of the problems, and you underlined it, is the fact that we are working in silos, that we are trained in silos. So how how do we build better alliances, and whom do we should get on board for these alliances to make things happen? Because I like we want to have the things happen now.
Yes. So, yes, thank you, Bettina. The alliances are very, very important, and not only important in countries where there are no trained dental professionals. So in other words, there have to be effective alliances. We saw that in the animation with regard to Ethiopia. But there needs to be alliance in every country that should be undertaken. Now, one of the things we had an opportunity globally with the introduction of the sugar tax. This was new money to come in, and then we could have done an integrated general and oral health programs. I recognize the priority in most countries about obesity and anti-obesity scenarios, but we could have actually done a common risk approach, and we could have actually had an integrated way. We've been monitoring most of the countries with regard that have introduced sugar tax, and I have to say is that there hasn't been very much integration, and it's been wanting. The pandemic actually should now refocus our minds. We should begin to have a common approach of how we communicate to the public and the impact it could have both on obesity and dental caries, and how we could actually design programs that are much more integrated than they have been.
Thank you. And I do see questions coming up, and I would like to put them forward. I have the question about how and what are the opportunities for dentists in training to join this course? Okay,
that's very, very good question, actually. So sometimes we think all these things are high level. These are all for chief dental officers of regional public health individuals, but actually it's every day, it's every dental professionals. So I work in a dental practice, and it's beholden on me to make sure that the children I see, that I'm communicating with the local doctor, the local general practitioner, that I fully recognize that the fact that these young children are also at school, and there's a school-based education that I can undertake. It's working collectively of all the environments around me where my families are interacting and where I can have an impact. So, well, that's one level. And then the other thing is taking up innovation, the new innovations in prevention that are happening that we can actually begin to introduce into our practices.
Thank you. And I see something very interesting now focused on the COVID situation coming up here. Dr. Colvin Jones asked us, he thanked you for the presentation, and he asked about fluoride prevention activities that stopped during COVID lockdowns, especially in her case and in her own country. And the question to you is, do you recommend that countries should look at introducing more automatic or structural prevention that will not stop during a lockdown, or others such as water fluoridation? We come back to this question of prevention.
No, thank you, Colvin, thank you for that great question, because one of the things we're going to have to do is recognize that, first of all, there's going to be less money around from governments into structured programs. So therefore, we have to be smart. We have to start to use our budgets in a creative way and in a strategic way. I think COVID has given us an ideal opportunity to rethink in countries where governments pay for remuneration of dental care, how they can reorchestrate that into prevention. But of course, one of the things I hope will be an outcome in countries that are considering water fluoridation, that COVID should actually drive the impetus for implementing water fluoridation, which is the most effective public health measure we can undertake with regard to dental cavities. So there needs to be an urgency. I think the key thing now, because we can see what the outcome of the COVID situation was going to be with regard to poor diets, with regard to economically challenged families in feeding their children, and also the other impacts about access to dental care. So if ever now, there should be urgency for all our activities, whether they be school-based programs, water fluoridation, or restructuring dental services, now is the time.
Okay, I see you look at COVID as an open window opportunity to push and to make pressure. I think we have time for a last question coming from Dr. Neha Jain. In a country like India, he asked, where the burden of oral diseases is high and stakeholder buy-in is low, how do we bring all the major players on board to raise the profile on oral health? So again, the question, how do we get these alliances? How do we get them together?
Good, thank you. I think the key thing at the moment is we need to recognize that the consequences of this pandemic, etc., are going to be considerable in almost every sphere of our lives. And we now need to explain to our other health professionals the importance of child oral health and certainly what poor child oral health will mean. So we have to actually start to embrace in India, not only the Indian Dental Association, it's multiple numbers of dental schools, but we also need to get our medical schools and the medical council as well involved. And of course, this is something that collectively professionals ought to be doing with regard to lobbying. And then to actually start to implement some creative prevention programs and to make sure that we implement them and drive those forward. Building alliances is often about relationships. It's about explaining the situations and then finding consensus as to with regard to approaches and early steps that we need to undertake.
Thank you. Thank you very much. I tried to go through the questions that came up. There are a lot of questions that, first of all, thank you for the presentation, but do look at special situations like in special countries, in South Africa, in the community reach that also underline the role of professionals like health, like dental hygienists. And I think we could go on by discussing all this for a longer time. I hope, Professor Raman Bedi, that you are available for further questions to be sent to you online or via the Oral Health Working Group or via the World Federation, because we want it to be short and don't not take up all of your time. But I would like to thank you now for having given this input that is a thoughtful thing that should all of us make think further. To all those who participated and sent in questions, thank you so much. Please stay in contact. We are trying to continue the discussion. And again, I would like to acknowledge the ones who made this possible: University of Geneva, the World Federation of Public Health Associations, the Dental Child Fund, and the Colgate, and mostly of all, Professor Raman Bedi. Thank you for your time, your knowledge, and your continuous worldwide activity. And to all of us here, let's take COVID as a possibility to get things advanced that we all think as a human right. And thank you to all of you.
Good, thank you very much, Bettina.